it just says Brookline Interact. Yes, it's Brookline Interactive Group and Pretty Twinkle Life. Melissa, I'm wondering if we should just be texting to be safe. But I feel good about this so far. Also, I'm going to email that group again. Maybe I'll BCC you.
Yeah, people get stuck and you can't walk down there.
PR agency folks, what are they doing right now?
They are, he's tweeting about the event. He's updating our website. He's tweeting about this meeting. And he's also putting together some graphics for us, about like cases in Brookline. And yeah, they've been doing a really good job. I'm feeling like they were the best money I've ever spent.
Well, that's good. It's definitely nice to have that extra help for sure.
Well, it's be like in the meeting and talking about the policy, implement it, and also write social copy, and also make sure to have a photo and create a graphic on Canva. It's like, ah.
Yeah, we totally understand. We've been running that way also.
Yeah. No, I know you guys get it, which is why it's nice to have you in partnership on this. And
oh, you're welcome. No problem. We're glad we can help out.
Yeah, I mean, what a time. What a time for public access, huh?
Yeah, I had a guy call me today. He's one of I can't remember his last name, John. He's running for town select board. And he was like, you have 5 minutes to talk about the future of Big. And I'm like, today? You want to talk about that today? And I was like, sure. So I talked to him and told him kind of the backstory about.
Bandwidth is looking better.
Oh, okay, that's good. Thanks, Andrew.
Thanks, Andrew.
I have to, whenever I talk to you, I have to mute him and vice versa so I don't get any feedback going back and forth.
That's fair. That makes sense.
Maybe we can have a cocktail hour on Friday together.
Oh my God, I can't wait. I cannot wait for social distance drinking.
Oh, I have a little glass of sake that my husband poured for me with some salmon from our friends.
What a hero.
I know. I was like, I think I can have a little sake tonight.
Oh yeah, I had a big Olivia Pope style glass of wine with popcorn last night.
Oh, nice. Yeah, you deserve it.
I mean, last night I was just like, I need a drink, but we're all good.
Did you get to any fitness classes this week at all?
No, not yet, but Melissa shared her Peloton account with me. So,
nice.
Which is like the ultimate, sign of trust. And so, I'm going to try and do one tomorrow morning.
Nice.
Yeah.
You have to have a bike at home for that?
No, because they have everything. They have everything on there. They have weightlifting, they have yoga, they have stretching, they have high intensity interval training. Yeah. So like, I'm just going to hook it up to my phone, to my TV, and then do it in the living room.
Oh, that's great. I did my own cardio kickboxing on Sunday, and then I've been doing like long walks with my husband.
That's really nice. Yeah, getting outside is huge during this time. It's like the nature is good for you.
I'm totally missing my HIIT and Tabata classes though. I'm like,
yeah.
Not a walk is not the same, not at all.
It's not. No, not the same bang for your buck either. Like calorie wise, I'm like, this is nice, but I like, when I get to, sweat my ass off and not think about anything and spin.
Exactly. I'm gonna go ride my horse. I don't own my horse, but I have a horse that I ride. I know. I want to tell Heather Hamilton because I didn't know until we were casting that she actually sounds like she owns hers.
Yes, big horse person.
Yeah, I wonder where she rides. I'll have to ask her all about her horse obsession. All right, I'm gonna go post the link on Facebook.
Perfect.
I left the meeting. Now I'm going to go back into it.
And I didn't hear anything when you came on. You're all
Okay.
good.
But I'm not coming in muted. I'm coming in live.
I didn't hear you ding at all when you came on.
Okay. But I should still come in. I think we should come in muted, no? So the ding didn't happen, which is good.
Hold on, Devin. Can you make sure people are not going to ding when they come into the meeting? I mean, I know it's only the six
Well, I
people
think
who are
it's
going
not
to
the
come
ding.
in.
It's the ding. I think you said didn't happen, right? It's just
No, it
that
didn't
not
happen.
coming in.
I'm sorry, you meant muted. Sorry, I meant that. I don't know if she wants that. Devin, do you want people to come in muted? Since they're members of the advisory body, you probably want them to be able to speak when they come on. You're muted. I can't hear you.
I feel like with this group, because they're kind of unfamiliar, I'd rather have them come in not muted, and then I have the power to mute them all.
That seems fine to me. There's
Can
not
you
very
hear it
many.
when I? Can you hear that ding when I mute?
No.
You hear that?
No.
Okay.
Nope.
I think it's just on our ends.
Just on our end. Okay, that's good.
Yep. Cool.
Yeah, you yourself can hear when you unmute and mute.
Okay, cool.
there's no audio, Devin, on YouTube or in the cable channels. I think I don't know where Melissa heard that audio.
I think it was maybe before when we were still live.
Okay, that's possible.
Yeah.
I just checked with him now because I just didn't want to say anything that we could be held accountable for later.
Yeah, fair. Very fair.
Devin. Can you hear me?
Hi.
Hi. Thank you for setting this up. I'm Pat.
Of course.
Yeah.
I'm Devin, Pat. It's nice to meet you. Thanks for getting on a little early and making sure that our kinks are worked out.
That's okay. This week I've been on Skype, Zoom, but this is my first WebEx from home, so I just wanted to make sure it worked.
Perfect.
So, I'll just play with the thing. So and that's off video and okay. Click here
Yeah,
to change the layout or view. Do you think I need to do that or?
It's personal preference. If you want to have your big screen be the person who's talking and all the other people little at the bottom, it just depends how you want the view to be. So it's up to you.
Okay, because otherwise you're the big one, right? So.
Right.
And will that be the case once this starts, or?
It depends. I'm not sure how you have it set right now. The way that I have it set is the person who's talking becomes the big one, and then when another person starts to talk, they become the big one, and it cycles in and out based on who is actually talking at the time.
Mine's not doing that, so.
Well, it's just us.
So I won't come big if. Okay. I think
right. So when somebody else joins us and starts to talk, you can kind of see how, because right now it's just you and me.
Okay.
So when the next person starts to chat, you'll see it move, and you can feel free to change the view if you find you like one better than the other.
Okay, great. Somebody's here.
Hi.
Hi, David.
Hi, David. How are you?
Good. Can you hear me?
Yes.
Good.
How's it going?
Good. It's good except for Tom Brady and Corona. Those are the
In that order?
two horrible things.
In that order?
No.
Yeah. I know. It's really hard for me to know what day it is. I'm having trouble orienting myself without all my usual things, you know?
So I have a 10-year-old and a puppy.
Oh, wow. So the puppy is good probably, right?
Except that he wakes up about 4:30.
But it probably keeps the 10-year-old really busy.
And me too.
Oh, you too, yeah.
Yeah.
What kind of puppy is he?
He's like a cavapoo. I mean, he's half poodle, half King Charles, something or other.
Oh, wow.
They were all called mutts when I was little, but now all these things have names. So.
Yeah. My son in Oakland found a dog on the street. He and his wife found a dog on the street, and they scraped his cheek to see what he was.
Okay.
And it came back, all the breeds that he was and what percentage and everything.
Oh,
So,
neat.
yeah.
That's great. That's
Yeah.
good.
He's just, he's a dog. He looks just like a dog, He's a brown dog. Yeah.
See if I can.
Yeah.
I will say to both of you just before we get started, if you can mute your microphone when you're not talking, just in case. Oh my gosh, he is so cute.
Oh, there he is. Oh, adorable.
Oh my god.
I think he's a cutie pie. But
That's a really cute dog.
That's his best trait by far.
He'll
Very,
come around.
very cute.
So it was nice is the vet said, "Now where did you get him? Because I want a dog like that." It's like
Really? Yeah.
That's the gold standard right there.
Very adorable. Your son must be in heaven.
my daughter.
Oh, your daughter must be in heaven.
Yeah, well, that's why we got her. Got this boy. Yeah. I don't know.
Yeah. Wow.
But I already have cabin fever, so
I've been getting out because
yeah.
okay.
My daughter and I go for bike rides. That's our saving grace.
Mm-hmm. But still, it's going to get old, I think. It's just going to, I mean, especially for the kids, right? Are you trying to homeschool her or?
No, well, her school now is starting to have something, so that's nice.
Mm-hmm.
And today she was on something like this with 9 other girls in her class.
Oh yeah, okay. So they know how to do that.
Yeah. It's not quite.
Although I never got too much out of it, but I've been in a couple meetings like this over this week, and I'm getting some more out of it than I usually do.
Oh.
I mean, maybe it's just a learned thing. I don't know.
Could be.
I've been in.
One of the people who was on.
Hey, Tony.
Today came back from China from spending a year and a half in China in late January.
Whoa.
He was just saying what he learned is don't pay for anything in cashes. That he thinks they're actually burning a lot of cash in China because they think it's infected.
Couldn't you just boil it in water or something like that?
Something. I don't know. I think the government's buying it back and burning it for putting out.
Oh. Do you think that could be true of our money too?
I don't know, but he was adamant don't use cash.
Mm-hmm.
And
one of the neighbors shopped from somebody. Take cash. Only would take Venmo. Wouldn't take cash for him.
Anything that passes hand to hand can cause it, right?
Yeah.
Folks, I did want to take a minute to encourage you that if you do have headphones, that can often stifle any kind of background noise that could happen in your house. So if you don't have them, that's fine. But we found, through trial and error that if you use headphones, it can kind of insulate the call a little bit.
Yeah, unfortunately, mine broke.
Oh no!
I don't have any.
It's like a tone of silence whenever I put them on.
My house is quiet.
Yeah.
My house is quiet.
We're just, as you obviously know, going through a lot of trial and error with this. So as we pick up little best practices, I try and spread them around to make the user and listener experience as good as possible.
Thank you for that. Yeah.
Oh, of course.
Yeah.
Do you think WebEx is the best, like a comparison to Zoom and Skype? Because I've been on all 3 now.
Zoom for me. I'm sorry.
I think that, what we like about WebEx for the town is that we use all Cisco products. And so this very seamlessly integrates to all the technology and infrastructure that we have in the town. In addition to that, it sometimes has more functionality than the other platforms. And all of them are sort of experiencing bandwidth issues. We're just, exposing our process sort of out in the open and illustrating all the bumps and warts and bruises as we learn. But yeah, I think WebEx is great.
Tufts just made a switch from WebEx to Zoom. We actually are finding Zoom much easier, much more user-friendly, much more functionality. So we're doing all our online teaching with it. And, WebEx, we've constantly had sound and video problems, sounds problems. I don't know if you've not had those. Yeah.
I mean, we haven't had, so we were, on task force calls all weekend. I mean, all day I was on WebEx with a group as small as 3 or as large as 30. And it was great in that vein. I think, we're obviously going to see tonight how streaming to the public works in this capacity. And this is also, it's a small group. But, we're going, and we'll be adaptable, but right now we're standing behind our IT department's recommendation, and until something really glaring happens to make us change, we're gonna, stay the course.
So how will the
Devin?
public get in?
Hold on one second. Hi, Gretchen. Did you just join us? Gretchen, I think you're on mute. If I can unmute you if you want to talk.
Okay, sorry about that. Hello.
Hey, welcome.
Thanks very much. I don't have my video on, but I can change that if you prefer.
Okay, that's correct.
Yeah, it's up to you.
Okay, just a second.
Hey, Devin?
Yes.
Can you just text us or let us otherwise know if you're ready, when you're ready to go, so that we know and you know that we're going live and that you'll be recorded from this point forward and on the internet and on the cable channels.
Yes. I'll leave that decision up to the chair.
Okay, great. We will listen for their instructions then.
Right.
Great.
And I think we're waiting for Dr. Jett to join us, right, as part of this meeting.
And Peter
Yeah, I'm on.
join us. Peter Moyer is going to join us too.
Yeah, I'm already on. I was
Oh,
just
you're already
listening.
on. Okay. We don't want to start officially. And again, one thing I would know how to do from Zoom, but I won't know how to do from here, particularly with the guest, is I don't know if at some point we're going to share the current mitigation plan. Is that something we can
Yes,
put?
that would be good. I don't know. Okay, let me see.
Dr. Jett, would it be possible for you to tilt your camera down so we can see more of your head and not just the ceiling?
Yeah, so second.
Also, Patricia, too, a little bit. That's, yeah, and Dr. Jett, just a little bit more, please.
Gotta go from
That'll look a lot better for TV. Thank you.
So this is going to be on Big. Is that how it works?
Yes. Yep. So you'll be on cable access, and it's also streaming on YouTube. But I would not recommend that you try and watch yourself on YouTube right now because it will slow down your internet and create a feedback loop.
Yeah.
But we should turn it
And Facebook as well.
audio off when we're not speaking.
Yes, 100%. Please mute when you are not speaking. And I can also I can mute and unmute people as the host. So just do what you're comfortable with doing, but we're going to try and keep everybody on mute when you're not talking. And if you want to queue up in the chat section and say, hey, I have something to say, I know David is talking, but I want to talk next, I can, I can make people aware of that.
So I don't know, Dr. Slop, how you want to do the mitigation plan. I don't know if you want to show it on screen or you just want to talk through it.
Well, I think at some point it might be useful to show it on screen if we can, and not right from the beginning, but it feels to me like we want to really talk about what's being done, and then I'll start being formally in a minute, but and then what, if anything, we are going to want to recommend be done differently, and then I think we need a process for continuing to meet or continuing to advise and support the health department as we work through this. So I think
And maybe Debbie can show it on the screen because I'm not as good with that yet. I don't want to slow down.
Deb, will you be able to do that when the time comes?
Yeah, she would be able to share it.
Yeah.
Okay.
Is everybody else on video as well as audio? I'm only on audio, but I suppose I could try to get on the video again. If we all see each other, this is Peter Moyer.
Yes, everyone's on video.
So I'm seeing some people, but not others.
The big staff are not on video at the moment, so we're just leaving that to you on the committee. We do need an actual call to order though to
Right.
go live. Just wanted to
Yeah, we
remind
need
you.
to.
All right.
Yeah, we should go.
Okay, let's do that. This is a call to order. This
Okay,
is an emergency
hold on
meeting.
1 second. Let's get this to a countdown here. So I'm going to let our team know. Andrew, we're going live in 5,
Okay.
Give me a thumbs up if it's yes. Yes, we're good to go. You're live.
Good evening, everyone. My name is Tony Sloff. I'm the chair of the Public Health Advisory Council for Brookline. This is an emergency meeting of our advisory council to discuss the COVID-19 crisis. I think the first thing we should probably do is just have everybody who is on the call and participating just quickly introduce themselves so everybody knows who's here. We go around there with just your name and your role either on the advisory council or the town of Brookline.
David Hemingway. I'm from the Harvard School of Public Health. I'm on the advisory council.
Hi, this is Gretchen Stoddard. I'm on the advisory council.
Did we lose Pat?
Oh, I'm sorry. This is Pat Marr. I'm a nurse practitioner, and I'm on the advisory council. Sorry, I was muted.
Okay, I know. It can take a couple of seconds to get off mute. And Dr. Jett?
Swanee Jett, Health Commissioner on Brookline Public Health.
Okay. And then we have some staff support from the town. I don't know if those folks would like to introduce themselves or...
This is Devin Williams, Director of Administrative Services for the town of Brookline, and on the rest of the call for staff support, we have Andrew, Kathy, and Anne who are supporting us via big live stream for folks watching at home.
Okay. Wonderful. Well, thank you for being here tonight. The reason for the meeting, I mean, Brookline has already done quite a bit to try and help mitigate the spread of the epidemic and to essentially work with the city, and sort of work with the state and with the federal government to implement as many of the social distancing policies and practices as we can. I don't know if there's a need, I hope there is not, to go in depth about the virus, the epidemic, where we stand. But I think the reason for a meeting tonight is that we know we're at a point in the United States where we're expecting the number of cases, both mild as well as severe, to spike fairly rapidly. There is a hope that the social distancing policies and practices that are being adopted will significantly change the peak of the epidemic so that the healthcare system will be able to cope. Brookline is a wealthy town. It's got a lot of expertise. I know that Dr. Jett is getting a lot of advice, both solicited and unsolicited. There's obviously a range of opinions about exactly how drastic we need to be in social distancing. I do hope that's why I was hoping we might look at the current mitigation plan. Before we do, I think I'd like to summarize it to say that Brookline has already, by and large, done most of the things that are within sort of local government control to fairly assertively put in place social distancing policies. They've also called on people to make personal choices and business choices that would promote as much social distancing as possible. There are other practices that have been done in other parts of the world and in some municipalities in the US that are even more drastic than have been taken here, such as mandating people stay in their houses, closing small private businesses, even if they're not places where multiple people congregate. There have been those kinds of suggestions coming to the town. The town is not, being a small jurisdiction, is probably not in a place where such actions would either be acceptable or would necessarily make much of a difference. That said, we've been asked as an advisory council to make sure that we're giving advice and perhaps getting advice from our own colleagues in the profession to make sure that anything Brookline could be doing and should be doing is being done. So with that, I perhaps would ask Dr. Jett to talk quickly about what is being done, and then just get a sense from people about, again, if they have thoughts about if there is anything else we could be doing. Dr. Jett.
So currently we are following the executive order, that the declaration of emergency that was done by the governor, but also by the Board of Health and the Select Board. So we have no restaurants or bars open to the public except for the restaurants are open for pickup. The schools are currently closed at this time, so they are working out how to continue learning for kids that's not in school. They are providing meals to kids Monday, Wednesdays, and Fridays for youth that need them. They also are working on a plan to provide computers to those families that need them, as well as stay up on lessons. We have taken measures to, I wouldn't say we didn't close the parks, but we have closed the playground. And that was with assistance from the Recreation Department and others. Trash services has continued. And then as of Monday, we opened up Emergency Operations Center. And Chief John Sullivan right now is the person that oversees that for the town. So in terms of public health, we have been constantly monitoring what is happening within Brookline in terms of not only restaurant takeout, but making sure we educate senior living, senior center, Hebrew Life, Brookline Housing Authority, in terms of best practices for safe distancing. Most of them have closed their doors, as well as all town buildings are currently closed at this time. There are essential personnel that's still in the building, but people that can work at home have been asked to work at home and telework. As a point of one of the major aspects of public health that I want to make sure we focus on is the contact tracing. Everybody that we need to quarantine, we quarantine in a timely period. And everybody we need to isolate, we isolate. To me, I think that's the quickest way, the most effective way, along with social distancing and mitigating the disease. So as of today, we have 8 positive cases. We no longer use the term presumptive. The state stopped that today. And we have 15 quarantined, and we released 8 from quarantine as of today. So that's a quick snapshot on what I could provide from public health. I'm sure that's just a summation, but there is a lot more that we're doing behind the scenes in collaboration with administration.
Just to let you know, we lost some of what you said. We heard from at 8 cases, and then if other people are like me, we lost the network temporarily.
So we have 8, if everybody's still hearing me, we have 8 positive cases. We no longer use the word presumptive. The state stopped that usage of terminology today. We have 15 people that are quarantined, and we have 8 people that was released from quarantine today.
I'm wondering if you could speak to, first, are there any other action? And again, I know that the primary work or the first responsibility is those cases that are being quarantined. In terms of the broader public and the social distancing, are there any options that are open to us that are worth considering at this time in your judgment?
So, that's a tough one because we would like to have people to stay in and only go out for essential items. So that's the rationale behind having grocery stores, gas stations, and the pharmacy open. But I'm quite aware that people still need to have the ability to leave their home. I am concerned about the mental health aspect. Somebody being in the house and being quarantined 24/7. I have heard to that extent as well, when you begin to quarantine parents along with their kids now at home, that there are some substance abuse issues to consider and mental health. And I have received emails that people are congregating in different places anyway, without any supervision. So even though we closed the schools, which was I think was a good one, but yet we didn't have enough structure in place to ensure that we kept the public safe. And so, until we have something across the board where everybody is teleworking, and of course, besides the medical community and first responders, it's going to be a challenge. And whatever we propose, if we propose something too stringent on Brookline, that doesn't stop people from other towns not doing the same thing that we do. And so we still exposing ourselves to more people in the population anyway, and to the disease.
Yeah. Are there recommendations that you have received, in any significant amount or number that, I think you've spoken to some of them as perhaps being more than would either be useful or that, that we could do without significantly upsetting, and needlessly bothering people in the town. Are there ones that you want us to discuss at this point?
Well, so I would say this, I have had some discussion in terms of closing down everything. So maybe just the board consider what would be the impact if we closed everything in Brookline?
Yeah.
What would be the impact if we closed the barbers and the nail salon? What would be the impact if we closed the parks? So I have received a lot of input that we need to be not only cleaning everything around the parks, everything from the light poles to the crosswalks, to just closing daycares, which I think the governor exempted now, but to close barbers, nail salons, just any business, period. Yeah. And what would the impact be, to Brookline? We might come to that at some point, but looking at our base, how to mitigate some of these issues based on what our current cases is and who's quarantined. And so I did look at the number exponentially. If we took no public health measure on day zero, where we had day one, we had 2 cases, that we could potentially have 1,024 cases in 30 days. But that's if we did nothing. We do have some measures in place, and you really don't know what the impact of that is, but we would see some of that within the first 15 days. So that's my summation of what I think.
Yeah, and just, I actually ran some of these questions by 2 public health infectious disease physicians at Tufts, who, again, sort of echoed that the key distancing measures of closing the schools, closing daycares, which has now been done, encouraging social distancing, encourage telecommuting, were absolutely necessary. In some way, what one of them said is that the next thing that would make a difference would be closing the MBTA, which is not in the town's jurisdiction. And both of them echoed also that the I guess the bang for the buck, the feeling that more assertive measures in terms of limiting individual movement or limiting or closing down business that are not places where more than a few people at once congregate would probably not significantly impact the epidemic, particularly in a jurisdiction of relatively small size. And as you say, until and unless the state stepped in and mandated this, region-wide or statewide, and it may come to that, but I think they echoed for me. I mean, I would like other people on the council to see if, from their own professional perspective or from talking to their colleagues, if there's any seeing this differently, that other mandated measures, maybe if it as this unfolds, but not necessarily today. Sorry to put people on the spot, but I think we're in a crisis, and there's a lot of opinion going around. Some of it informed, some of it not informed. There's a lot of data going around. Some of it is accurate. Some of it is accurate within, there's scenarios you can paint, some more optimistic and some not optimistic. So I think it would be good for us to weigh in, let the town know what we're thinking, and and see if there's a way that we can be supportive and make sure that people in the town understand that this is being, considered seriously, that we're being appropriately assertive in the face of a significant crisis. So with that, I'll ask anybody else on the council who would like to weigh in to do so.
Yeah, I'll just weigh in just a little. I agree, Tony, with what you're saying. And I think one of the things that the town can do even more, just from listening sometimes to people, is just to emphasize the importance of social distancing and why it's so important, and why young people, even if they think they're at very low risk, not just of getting the disease, but of having a bad outcome from the disease, why it's important for them to social distance, that affects the whole community, whether or not they do. And I don't think that's quite well enough understood, just from listening to chat boxes and stuff.
Anyone else? I want to just in reaction to that, David, as other people think about what they might say, is that we might try to make use of our own networks, particularly when we're hearing from people who are saying, you got to do more, you got to close everything down. And again, we say that's being considered, that's being thought of on a daily basis. We're also perhaps waiting for, and maybe we even want to think about whether we want to ask the state to be more assertive. But in the meantime, perhaps we can say to people who are, concerned enough that they're advocating for these aggressive tactics, is to say, make sure you're telling everybody, the very message that you stated. We live in a very individualistic and a very free society. And so people are not going to always take advice, but the more we can push that message out and get people to make that decision, for themselves, but also for the rest of us, the better off we'll be.
I was out today in the walking, and it seemed like people were being very mindful of keeping social distance, and also very appreciative to be able to go outside. There were a lot of kids outside, and I think that is tough to keep the kids separated. But I think, as you said, the important thing is to get the message out that social distancing is really the number one thing that we can do for ourselves, for our families, but also for the vulnerable people in our community. The elderly people, and we have a lot of healthcare professionals living in Brookline, and they are really going to be the key to getting to the, successfully ending this outbreak. So I think we have to make sure we keep them healthy too.
Just a quick comment that I'll make. I think Brookline has done actually, a good job trying to get as much information out there as possible. We have a website, we have an email and a call line. I think that's actually very responsive. And I agree that maybe we could do some more messaging. I think one of the challenges of Brookline, in our geography, we're essentially surrounded by Boston. So a lot of what we need to do here also needs to reflect what's going on around us. And going back to what Tony was saying about the MBTA, that's something that I think will be a challenge. And so I think agreeing with everyone around additional messaging around social distancing. So maybe there are some more efforts or even, public messaging we can do around town, whether it's posters or billboards or something like that. Maybe we can encourage more of that within the town.
I think another avenue is to have the teachers, because they'll be in touch with all their students, get the message out to the families that, especially with kids, as hard as it is to keep them separate, that will be a big key to us staying healthy as a community. And they'll be in constant contact with the families and the kids, I think, for the next couple of weeks.
On that same point, I'm curious to what extent families have been receiving messages. I'm sure they've been receiving plenty of information from the schools as well, but I don't know, maybe Dr. Jett, you can tell us a little bit about kind of the coordination between the schools and your office and the messaging around that.
So that's a good point. So from day one, part of the task force is Ben Loomis, the interim superintendent, and Tricia, and who's the nurse coordinator for the schools. And they have been an intricate part with messaging along with Devin. And we have hired a company that does communications now daily. But I can let Devin talk a little bit more about what has occurred, because it's broader than what I'm going to speak about. And she can probably go more in depth than me. So Devin, if you can, please chime in.
Sure, thanks, Dr. Jett. Since the beginning, working with the emergency management coordinator, we created a strategic communication checklist, which included, from the beginning, a message was crafted, the steps that it needed to go through, and the channels of who would distribute that. We have 3 key comms people working for the schools. We get their messaging, we make it uniform with what the town puts together, and then I know once that is vetted through our communications team, it goes on to the next format. And that's been working really well, especially with the robocalls. And then as individual schools are impacted, those messages are going out to parents and families. As many of you know, we use a system called Blackboard, where all of the contact information is recorded. And every way that a family has identified that they would like to be contacted, either via text message, email, or phone call, we hit a button once the message is final, and that goes out through all channels.
I'll just say, as a parent of a school child, a senior in high school, so on the older end, as of now, there's no plan for online pedagogy to go out. So there's not, therefore, a lot of communication to individual students. But I do think it's a great idea, should that happen, if we could craft a message for teachers to pass on to their students. So that, again, just, almost every communication to start with, understand social distancing, remember it, remember you're protecting yourself, your mom and dad, your extended family. That would be a lovely little addition, on the voluntary side. So.
Yeah, we can definitely work with the school to add that into our communications checklist.
Right. Dr. Jett, I'm also wondering, again, this notion that we're relatively small, we're surrounded by Boston, we are part of state, which is coordinating a response. How do we decide, and if and when would we want to perhaps say some of the things that we're being asked to do which don't really work or are not going to meaningfully affect the epidemic if it's done by a smaller jurisdiction. But we would, but one of the things that was floated to me by one of the infectious disease doctors is there has been a way that sometimes municipalities have led and then the larger entities have followed. So is there, how do we think about when we might want to say to Boston and to the state, we're thinking this is a good idea. We would like you to step forward and do this with us rather than having us do it alone. Is there a mechanism for that? Are we thinking about that?
So, I have spoken with the state, and we have open lines of communication with the state health department. So I think if we put together something to the state in terms of measures that we would like to see happen, I think they have been very receptive to it. If you look at our mitigation plan, some of the measures that we have in the mitigation plan, the governor has already taken. And so first, before we go into the mitigation plan, that is from PDC's mitigation plan that they published in 2017 as recommendations for local municipalities if a pandemic was to occur. This plan also is reflective of what has already been documented and used in New Rochelle and also in Seattle. And you can tell in New Rochelle, they used a containment zone. So it became that bad that the National Guard was called. And we have 7 different entry points into Brookline. So I was informed that that's very difficult for our current police force to cover. So I think before we went that route, I think the better arrangement to work with the surrounding towns and cities and use the select board and Mr. Kleckner and reaching out to them and say, this is our plan moving forward. We can also use the avenue of the state health department saying our number of cases is substantial. We want to take a more preventive measure, very cautionary, but with very sound fact that if we contain our borders surrounding the town, and if you do it as well in Boston and Cambridge, et cetera, then we think we can mitigate the outbreak. And so I think that will hold be more fruitful, especially if we get the larger communities buy-in as well.
And just to be clear, is that something that you're saying we would want to do now, or we would want to do if I'm not sure if we should say if, but when the numbers increase?
I think at a certain point, the numbers increase, and I think the ACPH think is we need to take some of these measures. I think it would be good to prepare and draft a letter, but let me take a step back. Even before we get there, I think it'd be fruitful for us to draft a letter for the governor's office, but also draft a letter for our surrounding towns and cities and say we would like to move regional with everybody's buy-in, and have that agreement or arrangement with them and moving forward together. And I think that's the best way we can control it regionally.
Okay. And that regional approach would be to essentially restrict movement across town boundaries.
Correct.
All right. Do you see that letter coming from you, from this council, from you and me jointly?
I think it would be jointly.
Okay. All right. I've been told because this is an emergency meeting, we probably want to refrain as much as possible from taking formal actions. We probably should see about scheduling a meeting next week so that there's enough time for the word to get out to the public so we have a true open meeting. It would also be online, right? As we don't want to it would be rather silly of us to congregate together in order to have a meeting about congregating together less. So, but that's something I would like to put on the table. But perhaps without there being a formal council action, if you and I could perhaps draft that letter in the next few days.
That sounds good.
Probably tomorrow. The sooner the better.
Yeah, that sounds good.
All right. Any? Go ahead.
This is Devin Williams again. I wanted to just convey that, as we continue to receive reports, we are going to send them directly to this council through Dr. Jett and Mel Kleckner, the town administrator. And really, we want to give you folks, this body, an opportunity to have a public forum in the coming days where, residents can ask you, our advisory group, questions and engage in a discussion. So if this group wants to move in that direction, we can support you in that opportunity to engage with the public virtually like we're doing tonight.
Is there any way, Devin, that we could begin to collect the public's questions prior to that meeting? Because that would allow us to prepare for them and think about plans, that kind of thing.
Absolutely. So we are receiving quite a few questions, as you can imagine, through our email account that we have set up, which is covidinfo@brooklinema.gov. And we are preparing sort of an FAQ that comes in and drafting our own questions to that. But we can also, publicize this forum and give people an opportunity to email questions directly for this forum and then get them to you in advance. We'll probably, employ a similar mechanism if you think it would be useful for live questions as well as pre-prepared questions so everybody has an opportunity to participate. But we can definitely get you the frequently asked questions that are coming in advance.
Great, thank you.
So would it be possible to look at the mitigation plan, to share that and just go through the highlights? I do think that might be, it's useful to know. I think it might actually be reassuring to us and to people watching how much has already been done and is being done. All right, I don't think we want to read through this in detail, but as we go through the outline, Dr. Jett, I wonder if I could put you on the spot just to, for every major category, just to hit the highlights of what is being done and tell us what's mandated and what is voluntary at this point.
Okay, so first I will start by saying the goal of the plan, the goals for the using mitigation strategies for the town of Brookline this time is to protect individuals at risk for severe illness, including persons of any age with underlying health conditions, including immune suppression, and especially seniors with underlying health conditions. It is also to make sure to ensure the healthcare workforce and the critical infrastructure is protected, and then minimize mobility and mortality caused by COVID-19, minimize the social and economic impacts of COVID-19, and also protect individuals, communities, business, and the healthcare organization through this mitigation strategy. So the implementation emphasizes individual responsibility of recommended personal level actions, empowering business, schools, and community organizations to implement recommended actions, particularly in ways that protect the persons at risk of severe illness, such as older adults and persons with serious underlying health conditions. It also emphasizes focus on settings that provide critical services to implement recommended actions to protect the critical infrastructure and individuals at risk, and then minimize disruptions to daily life to the extent as possible. So for every individual at home, we ask people to monitor the local information about COVID-19, practice personal protective measures such as washing hands, ensure a 30-day supply of medicines. Individuals at severe risk, we ask that they stay at home, avoid large gatherings, and any events of 10 or more people. And other individuals without such risk should adapt to disruption to routines in their life by using remote participation such as telework where feasible or online classes. The mitigation plan also includes what's happening in schools, schools and childcare recommended closing, which right now the schools are closed. Um, some childcare has closed, some of them are still open. But in every assisted living facility, we have asked them to implement social distance measures, cancel large gatherings, limit programs with external staff, and do daily temperature checks upon any attendees, staff, etc. And staff should wear masks and wash hands thoroughly before entering the facility. They should also suspend all new admissions to facilities. Short-term closures as needed if they have cases and do cleaning. Long-term closure if a facility has to be quarantined for any rationale. Suspend visitors' access by arranging for alternate measures for members to actually see family members. An exception should be taken for any end-of-life visits, which needs to be considered. For Brookline, every workplace should encourage people to telework, expand sick leave policies, implement social distancing measures, stagger work schedules, decrease social contacts in the workplace. All breaks must accommodate distancing with regular disinfection of all eating surfaces, eliminate work-related gatherings, postpone non-essential travel, regular health checks, implement extended telework arrangements, ensure flexible leave policies, and counsel work-sponsored conferences. Upon every community and faith-based organization, implement social distancing, reduce activities, consider offering video or audio of events, determine methods to continue providing support services to individuals at risk of severe disease, cancel any gatherings, professional college sports as well, and for organizations that severe high-risk communities, cancel gatherings of 10 or more and stagger access to support.
If I could just ask a question here, because this seems to be one of the places where, again, I don't know whether we would have jurisdiction or not. Any of the, again, not necessarily closing businesses, but can we forbid meetings of a certain size so that, essentially telling the community organizations that they may not hold meetings? Or is this all at the level of recommendation?
Correct. So the Board of Health and the Select Board have reduced the amount of gatherings to 10 from people in line and people in line and outside line to no more than.
And that's a mandate, not a recommendation?
Yeah. That's actually was passed, I believe, Monday.
Okay, thank you.
Yes. So, and remember, the Board of Health and the Select Board did declare an emergency. So, in order to control infectious disease, there is a little bit more power to that declaration, especially if we're trying to contain it. Healthcare settings, some of the suggestions include temperature checks frequently, implement triage before entering facilities, actively monitor absenteeism, actively monitor supplies, establish process to evaluate and test large number of patients, permit asymptomatic exposed healthcare personnel to work while wearing a face mask, cross-train healthcare personnel for working in other units to support staffing shortages, restrict all visitors from facilities, entry to reduce facility-based transmission, exceptions are end of life, identify areas of operation that may be subject to alternative standards of care and implement as necessary, cancel elective and non-urgent procedures, establish cohort units or facilities for a large number of patients, consider requiring all healthcare workers to wear face masks, when in facility depending on supply, and considered suspension of new admissions to facilities. And of course, that would be different if you have somebody with severe disease and you suspect it's COVID. Other things not mentioned but need to be considered if caseload increased to 250 or more. Close businesses except gas station, grocery stores, and pharmacies. So we haven't done it to that extent, but that would be one. Reduce traffic into Brookline. Close playgrounds and any other public facility. Close parks if outbreak persists. Curfew at 6. If schools remain closed, kids must stay home with their parents indoors. Cancel all in-person meetings and move them to virtual or phone call. And that would be for anybody in Brooklyn. And that's the end of the recommendations or the mitigation strategies. And the rest is just a list of underlying diseases or chronic diseases that a person might have that need to be excluded for risk of COVID-19.
Thank you. Is this plan on the website?
No, the plan was in draft form. I did have, a few edits to make, suggestions that came from Chief Lipson.
Yeah.
And I have some suggestions that came from Mary Minot, looking at the mental health, and which Ian Lane also mentioned, chimed in from Brookline Mental Health Facility Center, chimed in terms of the mental health. Mary Minot, that works in the school system with substance abuse, brought up some concerns surrounding kids being at home with their parents and mental health aspect, but also the increase in substance abuse and noticing something troubling happening right now.
Yeah. Yeah, that's a real concern. Other members have questions or comments about the plan?
Have you, Dr. Jett, heard any complaints about a shortage of personal protection equipment for the assisted livings?
I haven't heard any complaints. One of the things that, we have not practiced a pandemic exercise in Brookline for some time. So right now we have begun to reach out to all facilities to try to get a status report on a daily basis, which, I hope to put on a dashboard so that everybody can see, at least internally among the EOC operation. Because what I am concerned about is if our cases do increase, I want to be able to have a pulse on what's really happening on the ground and the needs of different facilities as well as, people. And I am concerned too, we asking people to continue to serve food, which I think we should. But how do we protect businesses that do stay open?
Mm-hmm.
So when the plan is final, is there any reason not to post it? It feels to me, one of the challenges I think in this setting is that social distancing is in a way doing nothing. It's aggressively doing nothing, and so it might be hard for public just to see how much has actually been done, has been thought through, the steps that have been taken to protect. And that might be one of the reasons why, again, it's not that people calling with concerns is a bad thing, but we want to make sure that we're not overwhelmed with calls that are really, that can be mitigated just by having the information out and easily accessible to everybody.
If you think that that's plausible, I would definitely consult with Mel and town council and the select board, because some of these have potential, I would say, legal ramifications. Because if you institute a curfew, but exactly how do how we go about that, or if you want to protect the borders and close down the border. So, even though we talk about the policy, but I think it would need further vetting so people will feel comfortable with those measures. Of course, we're talking about if there was 50 or more cases in Brookline.
Right. No, I see the argument not to post hypotheticals or speculations about what might be coming, but the parts that are already in place, I'm wondering if there'd be any reason not to post those. Again, because I think they've already been vetted, they've already been approved, and they're in place, and people might not know. So
yes, we have talked about it in public. Yes, we can post it.
Yeah.
But I would post it with the auspice that it is a fluid document and it is a draft.
Right. And it's subject to change as conditions change.
Correct.
Yeah. Right. How can we support you moving forward? I mean, I know, there's a huge amount you're doing. You're also, getting a lot of questions and queries. People want to make sure that you're getting, good advice. How can we support you?
Well, I think first, we do have letters that have been drafted and signed off on that has been distributed among 94 people in town. And I'm concerned about some of the data that specifically is in the document.
Yeah.
Because some of it is not scientifically sound, where the data came from. It hasn't been validated. And it hasn't been properly vetted. So I believe, when we have such documents that circulate around town, I think it would be helpful for the council to weigh on those documents and its validity and look at it and see first for the amount of data is in it, make sure it's valid or not.
Yeah.
And look at the plausibility of public health measures. Because, in public health field, we've all taught about how to properly message and how to practice risk communication. In fact, I think it's beat into us with such a drum that we refrain from being alarmist and create panic. And so I think having the advisory council weigh in on some of these documents that circulate, and the proper public health measures, and the proper mitigation efforts that we should take as a town, I think that would be advantageous to not only myself, but the select board as well.
Right. So I think that I know the document you're talking about. I can circulate that around. We've also had a retired public health physician write a commentary on it. Actually, some of it is a little bit beyond my expertise, but I think her comments are generally on target. I think we should circulate that among the group.
I think the document that you wrote actually, and I don't want to be a guru on statistics no more, even though I had 13 courses in it. But I think she was able to dissect it in a short amount of time. She was trained by Dr. Del Mari, who was
Aldi Maria, the former state epidemiologist.
Correct. And so he was quickly able to dissect the document and able to identify the sources of data where it came from and showed its flaws in its entirety.
Okay.
And so I think that is very feasible in order to share that with the general public. But I think also ACPH should write a response letter to that, but also it would be helpful maybe to put something in the local tab or the local newspaper as well in terms of what is the appropriate measures to take, how, et cetera.
Yeah.
And I would leave that totally up to your discretion as to what you think is feasible.
All right.
I have a quick question. I think I know the letter document you're talking about, but I'm curious to know who actually received that, or how many people, or who that went to and how.
Yeah, I don't have the answer to that.
So give me 1 second. Mary Sabosi, who is infectious disease doctor, has an MPH of biostats. The document was circulated by John Harris of CAB. And so you have Climate Action Brookline, and it went out to 94 people on this email chain. And I can forward that to you. It was a lot of people. And so it also went out to town meeting members who is active in the Green Movement, Climate Action Brookline.
Okay, thank you.
Yeah. All right. One of my concerns in responding to that document, again, I didn't vet the sources and I didn't do the math. There's such a wide range of scenarios that may play out. We don't know how well our social distancing is going to work. I'm not sure that the scenario that got painted there, it's not, I think the problem with the document is it painted it as that this is what's going to happen. I'm not sure it's presenting something that isn't within the realm of a possible range of scenarios. And we got to be careful if we're going to speak, against the document and the data that's in it. And we're also not telling people that something that might happen isn't going to happen. And so that's talking about health communication. That's a very difficult needle to thread. I guess I'm finding myself a little cautious about endorsing something that contradicts that document, unless we think it through very carefully. And I would want a little bit of, would probably want more expert advice, on the projections and where they fit, not just in terms of specific accuracy, but accuracy is within a range of possibility.
Well, so that document, I don't think has anything, it does us any good in Brookline. I'm more curious about Brookline, because I can't protect the country.
Right.
So I reached out to Northeastern University, the person who actually does the data analysis and computer modeling of disease outbreaks. And he is the same expert that CDC is using.
Yeah.
And so I've reached out to him. I talked to him last week at the mayor's health commissioners gathering. And I think that's the person to go to if we want expert advice on computer modeling for Brookline. And the person could put in measures in the model that dictate what happens if we close school, what happens if we close business, et cetera. And I prefer to use that. And I think that would be accurate for a population size such as 59,000 in Brookline.
All right.
And
do we have I'm sorry.
Sorry. And Dr. Jett, have you heard anything from anybody who received that email? Has there been a response to it or questions?
So there was 2 different documents that were circulating. One was an email that was signed by 50 physicians that said we should take a lot of measures based on the R0 of the nation.
Yes, I saw that. Yes.
And so a lot of it was to take drastic measures to close everything. That was the premise. From preventing people from, I've gotten emails from stopping people from walking down the street, to people in the park, close the parks, close every business. I have gotten emails in terms of from this. Can you tell me who in my building is quarantined? Some people in buildings from the document want to do temperature checks of everybody in the building. So some of this, what is being discussed, what I'm afraid of, crosses the line of people's civil liberties and HIPAA violations. And, you know, I don't think we're there yet, but I would like something probably coming from the governor's office, then for me to make some drastic decision or recommendation, take it and ask the select board to weigh in on it. And select board has been getting all the same emails. So they email me, they email Ben Loomis, the interim superintendent, they email Mel, and then they CC the select board. And so some of these, it would be very helpful as we share the emails just for advisory council to weigh in on it.
Yeah.
And so, Patricia, if you have something about it, because you saw the email, I guess it would be helpful for you to weigh on your thoughts about the email.
Yeah. Sorry, go ahead.
You know, I would need more time to look at it more closely and everything, but I think it's important that we do look at it more closely and respond.
Yeah. It's a challenge, you know, in terms of our timing, because we should all look at it. Any deliberation that we have about it needs to be public. So, I mean, I am willing, if other people are, to try and get on the line, perhaps for a briefer meeting tomorrow. I mean, you know, again, I was thinking that we would have a public meeting next week to more, you know, fully vet what's good, public opinion and what we can do over the long term. But it sounds like this one needs a response quicker than that. Are people available tomorrow night?
I'm available.
All right. I'm the one who made this late because I was seeing patients until right before we started here. But tomorrow, I'm on a better schedule, so I could meet earlier in the evening. You know, if we aim for 6 o'clock.
I'm open.
I can do tomorrow at 6 as well. It would be great to have the emails and any other the rebuttal or other conversations that we can about that.
Yeah, I mean, again, those are not documents that come from us, so I can share those with everybody. I'll get those out to everybody tonight. You know, and again, I would encourage everyone not only to look at them, but again, you're not, as an individual members, we're not beholden to have conversations with people we know who are experts. Being a public conversation, it's when we talk with each other and the opportunity to influence each other that we have to be public. So I might run both that document and the rebuttal that I've seen by, again, a couple of my you know, infectious disease epidemiologists, so I really trust if other people have a chance to do that, so that perhaps tomorrow we can craft a response that we can get out. I realize not everyone may be able to do it, but we can get a quorum tomorrow night. And Devin, is this going to be difficult to essentially set up again? Something that the public can listen in on?
The setting this up is not a problem, but we will need to confer with Big and their schedule. I'm sure advisory committee is meeting tomorrow night, and they can't necessarily be, you know, filming all of these and broadcasting them at the same time. So I can 100% check in on the schedule, and we can, you know, find a time slot for you guys, with 6 o'clock being your first preference, obviously.
Okay. We might have to be flexible there. Okay, that would be great.
Should we give you a second preference?
Yeah, of course.
Is 5 o'clock possible for people?
Yeah, I think tomorrow my schedule's pretty flexible in the evening.
Yeah,
think it's
fortunately,
okay.
break, because usually I'm teaching a class Thursday nights, but I'm wide open. 5 would work for me, too.
Okay. So it looks like school committee is at 4 and 6 o'clock tomorrow. So, if that meeting only runs for an hour, you could do 5 o'clock, but we can have this conversation offline.
Okay. All right.
Evan, I just have a quick question. Did we have anybody that had questions, or we didn't open it up for questions for anybody?
I had been following the YouTube comments, and only one person commented, and they just asked us to turn up the volume, and so we did.
Isn't that unusual for a town meeting? Don't they usually ask us to turn down the volume?
How many people did we have listening in? Did we know?
I don't have that information right now, but I can definitely get it to you. We did post it on all of our social media channels, and we were also streaming it through brooklinecovid19.com. So there were a lot of places that people could have found this meeting if they wanted to. And we'll obviously post, this will be ready tomorrow to be shared as a video link where people can watch it after the fact.
Okay. That will be true tomorrow as well.
Yes. Yeah, so it won't be ready immediately available to watch tonight, but tomorrow after it's been edited and everything, it will go live.
All right. Before I call the meeting to a close, is there any other comments? Like, you had any other business you want us to speak to?
No, I just I want to thank everybody for coming together at this last moment to weigh in on this important topic. I just want to say, I really do believe every community is struggling with this kind of challenge. But I think my utmost concern, is to make sure we do have a response from the community, especially to the medical community. But also, we might need hands on deck in terms of contact tracing and making sure people are quarantined and isolated in a timely manner. And to me, that's the best public health mitigation that we can do. And then the second part is, making sure people only leave the home for essential items. Otherwise this will continue, and we will have to move towards something more progressive that Italy has done, or China. So I think that's something very much in our realm, in the council's realm, that we need to weigh on and actually identify what triggers different measures, what case amounts triggers different measures at what time.
Yeah.
And so that support is greatly needed.
All right.
I also wanted to let you folks know that there were Facebook viewers who were commenting and engaging, and that was great. And just take a minute to share that, the town resources are up and running. We have our emergency operations center. We have our call center. And the number for the call center is 617-879-5636. And those are non-medical questions specific to COVID-19 in Brookline. For any general COVID questions that are not specific to the town of Brookline, the state has provided a 211 line that we recommend people use. And as always, brooklinecovid19.com for any of the information on closures, on, where to seek medical help. We will point you in the right direction there.
Okay.
Thank you.
All right. And perhaps so tomorrow's agenda, right? The main item is review of the email that's gone to many people in Brookline, and discussion about a council response that would be made public to address any inaccuracies or statements in there that might do more harm than good. I guess the only other thing to perhaps revisit in the agenda, I know, Dr. you are thinking about this, is whether we want to be specific about recommendations to Boston and the state as to anything more aggressive at this time. So perhaps, again, if we have a chance to sound our networks out and be prepared to just touch on that tomorrow.
And I would also say, possibly, since we did do it tonight, but to do a possible vote on the mitigation plan.
Okay. Yeah, we should have enough time to get the public word out to take that vote. Okay, so that would be a third agenda item. Okay, I very much appreciate everybody's time. I think at this point we call the meeting closed. Thank you all.
Thank you.
Thank you.